We are live.
Well, good evening or good afternoon, everyone. My name is Michael Hinni. I'm one of the surgeons here at Mayo Clinic in Arizona and the inaugural medical director of our exciting new Multidisciplinary Cosmetic Surgery Center. Now, we have been providing cosmetic services here at Mayo Clinic in Arizona since 1987 when we opened. And what's different now is that we've spent a fair bit of time, literally years, piecing together a first of its kind multidisciplinary cosmetic center, complete with a new space in which to work. You may be aware that there's an awful lot of cosmetic surgery being done in the Scottsdale, Phoenix, greater metro area in Maricopa County. In fact, per capita, there's more cosmetic procedures done here than anywhere in North America, including LA and Hollywood. So how are we going to succeed in this new space? I will tell you. As is typical of the Mayo Clinic, we work in teams. And as you can see on your screen, some members of that team are present here tonight and will be addressing you shortly. We have experts from general plastic surgery, from facial plastic surgery, from cosmetic dermatology. We have laser experts. We have vascular surgeons involved, gynecologic surgeons involved, all working together to provide you the very best product anywhere. So I welcome you to this event, and I would stress that differentiating features of this center also include that we will train residents and fellows. And as you may be aware, in teaching facilities, care tends to be superior. Another differentiator is that this cosmetic center will have bench research being done. And we are leveraging our Center for Regenerative Medicine, and we'll be bringing regenerative medicine and stem cell therapies into the cosmetic space to enrich your life. So the format here after this introduction will be to introduce you first to our newest cosmetic dermatologist, Dr. Elika Haas. She, like the other speakers tonight, all trained here and then did specialized fellowships strictly for this purpose. Following her, Dr. Brittany Howard, a facial plastic surgeon and the chief of the Division of Facial Plastic Surgery here at Mayo Clinic in Arizona, will make an address. And then the chair of the Division of Plastic Surgery, Dr. Alana Rebecca, will also be making a short presentation. We are happy to field your questions during the presentations, and when they have concluded, we will have a round table and get busy answering your questions. So feel free to send them in whenever you wish, and we will start to collate them as we proceed. Well, thank you again for joining us on this live event as we roll out this new multidisciplinary cosmetic center. With that short preamble, I will turn the microphone over to my colleague, Dr. Haas from the Department of Dermatology, as I said, fellowship trained in cosmetic dermatology. Dr. Haas, take it away.
Great. I will share my screen here. So thank you, Dr. Hinni, for the introduction. I'm so excited to be here with our colleagues in facial plastic surgery and general plastic surgery to talk about our new Multidisciplinary Cosmetic Center. This is a project that I'm really excited to be a part of. So a little bit about me. I trained here at Mayo Clinic in dermatology, and then I did a fellowship in California at a practice called Cosmetic Laser Dermatology, where I trained with 6 experts in the field of cosmetic dermatology, where we did solely cosmetic procedures and cosmetic clinical trials. And I'm excited to bring what I've learned here to Mayo Clinic. So what is a non-invasive procedure? That is what will be the focus of my talk today. These are non-surgical procedures done in an outpatient setting, and they usually require only topical or local pain control, and there's often minimal break in the skin. And in general, these are considered to have a lower downtime. So I like to group these in 3 different categories. So injectables, lasers, and energy-based devices, and then other procedures. And so we'll start with injectables. So first, wrinkle relaxers, also known as neuromodulators. Some brand names of these that you might hear are Botox or Dysport. And why do we use these? So we use these because as we age, we get wrinkles that form from repeated muscle movement. So frown lines, lines on the forehead, lines around the eyes from smiling. And so Botox or these other products are FDA approved for all of these areas to relax muscles by causing paralysis of the muscles temporarily, and this prevents wrinkles and also softens existing wrinkles. And the results can last 3 to 6 months depending on what area is treated. We also use this on other areas too. These are off-label uses, so we can use it for a wide jawline or for patients who grind their teeth. We can use it for increased gum show when smiling or downturned mouth corners. It's also used for sweating and it can also be helpful with scars. Next, dermal filler. So this is another injectable procedures. These are known as hyaluronic acid fillers. You maybe heard of Juvederm or Restylane. These hold on to water to give volume to the treatment area. We also have biostimulatory fillers. These last longer and they can actually stimulate your own natural collagen production. And so why do we use these? So dermal fillers, such as hyaluronic acid fillers or biostimulatory fillers, are used to target areas that we lose bone and fat as we age. So when we lose bone and fat, we start to see sagging of the overlying soft tissues, and we kind of lose volume in our cheekbones and develop wrinkles or jowls. And so by restoring this volume, we can rejuvenate the face. And so we use these fillers both on the face and the body. We can even use them for volume loss in the hands or wrinkles above the knees. And the results can last 6 months to 2 years, and that kind of depends on what product is picked and where we place it. And in general, these have a low downtime, so mild swelling and bruising is possible with any injectable procedure. Next, deoxycholic acid or Kybella. So this is an injectable option for extra fat under the chin area. And what this does is it dissolves the fat permanently over a few sessions, spread about a month apart. And with this, you can have some swelling, numbness, and redness that lasts about a week right there under the chin area. But you can see, you know, in this patient, there are nice results with softening of that fat and improvement of that jawline contour. So what about lasers and energy-based devices? So we use these for so many different conditions. So we'll be treating sun-damaged skin, melasma, rosacea or blood vessels, acne scarring or other types of scarring, as well as fine lines and wrinkles, loose skin or skin laxity, and tattoos can also be treated. We have a wide range of lasers, so many different lasers, and these can be used to target redness, brown spots, wrinkles. And the great part about our center is that we have so many different options, so these can really be fine-tuned to your skin type and your needs without causing adverse effects. And then what about other treatments? So we will have a wide range of other procedures, and I kind of just put these together for simplicity. So InstaLift is a suture lifting procedure for skin laxity and collagen production. We'll be doing PRP for hair thinning or skin healing. Skin pen will be used for micro needling, and this is great for skin of color, for aging skin, or for scars. We'll treat leg veins as well, and we'll be able to remove benign growths such as moles or keratoses, treat scars with a wide range of procedures, and then of course we'll talk about skincare and a good skincare regimen. So why choose the Mayo Clinic Cosmetic Center? So with the popularity of injectables and the increase in these procedures as well as laser procedures, some people might argue that this is kind of the same as getting your hair or nails done. You know, everybody's doing it. People are starting at a younger age. But I would really argue that these are medical procedures. They require skill, science, and understanding of the products to have a good outcome. And so these are some cases kind of here in the Southwest where infections were seen. We also see burns and scars when these procedures are done by the wrong hands. And so when they are done correctly, there's actually 95% satisfaction rate when these procedures are done by board certified physicians. And I think that's really important when it comes to doing procedures for cosmetic benefits and for improvement of your skin. So with that, I really hope you choose to come see us at the Mayo Clinic Cosmetic Center, and I'll hand it over to our next speaker.
Dr. Haas, thank you very much for that. I'm so glad that you have joined us in this center. You're going to help us make it great. Next, Dr. Howard, are you on the line? There she is.
I am. Thank you so much for letting me join in this conversation. It's such an exciting time as we start to expand this center and offer all the services that everyone here is so well trained to provide. So I'm going to similarly share a small presentation with the group. So my name is Dr. Brittany Howard. I am one of the facial plastic surgeons here at the Mayo Clinic in Arizona. I am the chair of the Division of Facial Plastic Surgery, and I have been with Mayo now for 10 years. I originally did my training here and then went on to do a specialized fellowship specifically in head and neck cancer and complex reconstruction. And due to an extreme love of providing reconstructions that were not only functional but also aesthetic, did an additional fellowship after that, specializing just in facial plastic surgery, again for cosmetic and for reconstruction. And I've been back and joined the staff here for the last 3 years. So today I want to talk to you and just give you an idea of some of the things that facial plastic surgery is involved in. Facial plastic surgery is sometimes not as well understood. We understand plastic surgery and we understand plastic surgeons. It's a more common specialty with phenomenal specialists. Facial plastic surgery is its own special type. We are individuals that have done 5 years of training in head and neck surgery only. We're otolaryngologists by base training, and then additional fellowship here specializing just in reconstruction and aesthetic procedures on the face. And it's been such a pleasure to come back and work here with Dr. Hinni, with Dr. Rebecca, and with Dr. Haas as we built this cosmetic center. So I'm going to talk about first some concepts in facial beauty. Since if you're going to think about doing any procedure on your face, we want to have an idea of some grounding of what would be potential goals and outcomes from that. What is facial plastic surgery? And a couple of examples. So one part that we have to start with is, again, anytime you're thinking of altering something on your face, this thing that is the identity of you, is we have to decide what it is we would want and what our goal is. And often that comes down to a question of what makes us beautiful, what makes us feel good about ourselves, how do we self-identify? So very commonly think of beautiful as being something having to do with symmetry or potentially with perfect or beautiful skin. It can be something that we think of related to an individual's smile or potentially their hair or their lips. And sometimes we also think of it being defined partially by our age or our nose. Are we young or have we aged gracefully? So with that, I think that for me at least, that I start with knowing that every person I've met is beautiful. I've never met a woman that wasn't beautiful. And facial plastic surgery is not about changing who you are, changing what you look like, or looking like someone else. It is meant to identify what your signature characteristic is, the thing that makes you feel like you, that embodies your spirit and the message that you're presenting to the world, and amplify that and help to reduce or remove anything that might be distracting from that. So sometimes we feel like our nose maybe is distracting from the beautiful eyes that we were given, or that our face has started to age in such a way that people don't see the actual vibrant individual that we are. Those are times when it's very often that we see people come to talk to us either in cosmetic dermatology, in plastic surgery, or in facial plastic surgery about having some of these things gently altered, not to look like anyone else, but just to look like the very best version of yourself. So facial plastic surgery, to me, is something that enhances you, restores you to your ideal, where we can improve your self-confidence, improve your self-esteem, and again, maximize you. It's not about being something else. It's not about someone else's definition of beauty. Who we are and what makes us beautiful is entirely unique. It is sometimes tied in with culture or ethnicity, and we want to recognize that and validate that and keep that whenever we're thinking of doing any alterations. So I'd like to share a story of one of my patients that I think very much embodies this. This individual is one of the most wonderful women. She's 64 years old and is vibrant. She is a competitive cyclist. She travels all over the country doing bike rides that are hundreds and hundreds of miles long. She is a power in her specialty field at work, but we would talk and she didn't feel like that vibrancy and that life came through when people met her, maybe just going off of her facial features. She felt like she looked so much older than the rest of her life said she was. She noticed that her lower face was sagging down, that she had developed jowls, that she'd lost her neckline, and she was wondering if there was something that she could do about this. So she and I had long discussions, and we very seriously considered what we wanted to do. For her, she wanted something that was as little as possible because she is so vibrant and wanted to immediately be back to all of her activities. So for her, we selected doing just a deep plane facelift. We elected to not do anything in the upper face, to not change the eyes or the lids or the brows. She still felt that her eyes spoke her truth and that they looked like her, but she really was unhappy with how that lower portion of her face had aged. So this is her after her deep plane facelift. She still looks like her. She just likes like the best version of herself at 64. You can see that her neck is lifted and she has a nice clean line again. She's got a tightened jawline. Her jowls are gone. And this was all done with just a deep plane facelift and no additional work. This is about 3 months out. You can still see incisions. We've maintained her hairline and she's just continued to heal and is very happy with this, and nobody thinks she's had anything done, which ultimately discretion is so often one of the keys in doing these and in working with patients and individuals. If someone comes to see me and trusts their face to me, I also greatly value their privacy. And so for that reason, the next set of photos are just a discussion and a typical patient story rather than sharing anyone else's personal photos. And I hope that you can understand with the delicateness of doing facial plastic surgery and wanting to respect every person's individuality and their privacy. But this would be another typical story that we would have, which would be, again, a woman who was living a wonderful life and very active, but maybe didn't always feel like that came through in her appearance. At first glance, she still has a very young lower face, a tight jawline, a slim neck, unlike our last individual, she hasn't developed jowls, but when we take off those sunglasses, her aging has predominantly been present around her eyes. We see that the brows have dropped, that she has heaviness across her upper lids, and that she's lost a little bit of volume in the lower eyes that give that sensation of kind of bags and increased skin creping or wrinkles in that area. So if this were my patient, we'd be talking about his upper face restoration, doing a brow lift to lift and reposition the brows, to reframe the eyes, to smooth the forehead, an upper lid blepharoplasty so that we get that excess weight off of the lashes. We open back up that visual field, and potentially some fat grafting to restore volume if it seemed like that was something she was interested in. So facial plastic surgery can run a gamut of different types of procedures, and every single one of them should be individualized to the person that's asking the question of, could this help me? Could this make me feel more like myself and improve my self-esteem? It can vary from everything from structural surgery, things like rhinoplasties or cheek implants or facial contouring. For rejuvenation, which is what we've more talked about today, it can be Botox and filler, such as myself and Dr. Haas and Dr. Rebecca all do, facelifts and neck lifts, brow lifts, this true repositioning of the tissues to raise everything back up and recreate some of those youthful contours, blepharoplasty, eyelid lift, fat grafting. And it also is reconstructive surgery. This is something where when someone has to go through reconstructive surgery, it makes sense to trust your face to someone that not only does reconstruction, but also does aesthetics. Because again, one of the things that always made me love this entire field was the idea of providing someone not just with a functional reconstruction, but an aesthetic one. So very, very often our patients are coming with a history of cancer or Mohs surgery, trauma that they're wanting to have repaired and improved upon. So beauty is in every single individual, and it is something that facial plastic surgeons just try to help to amplify if there's something that we can provide a meaningful benefit with. And thank you so much for your time. I hope that you'll come and see us at the Multidisciplinary Cosmetic Center here at the Mayo Clinic in Arizona. We have an amazing team put together, and this is going to be a wonderful journey. I will give this back to Dr. Hinni now.
Thank you, Dr. Howard. Lovely presentation. I would remind the audience that these three experts aren't the whole center, but they are certainly a key component of it. Dr. Alana Rebecca is the chief of the Division of Plastic Surgery here at Mayo Clinic in Arizona, and you have the floor.
Thank you very much, Dr. Hinni. So can everyone see my screen? My name is Alana Rebecca. I am the chair of the Division of Plastic Surgery here at the Mayo Clinic in Arizona. I've been with the clinic for 15 years, and I did an advanced cosmetic and breast reconstruction fellowship here prior to joining the practice. I'm also the section head for cosmetic surgery and the head of diversity and inclusion here at Mayo Clinic in Arizona. As you'll see from my discussion, there's quite a bit of crossover between the dermatologic, facial plastic surgery, and actually many of the other urologic, gynecologic, vascular, and radiographic specialties that we have in the clinic. I think that this multidisciplinary cosmetic center is actually the best of everything all in one place, and it's going to give our patients the safest, most effective care that they could possibly ask for our cosmetic procedures. As you can see on the slide, the American Society of Plastic Surgeons 2019 statistics for the top procedures indicate which procedures were most commonly performed by plastic surgeons in the United States, as well as in Canada and in Europe over the years of 2019. Breast augmentation, liposuction, eyelid surgery, and rhinoplasty and facelift have been some of the biggest procedures. When we think about breast augmentation is a surgical enlargement of women's breasts. It has become significantly more popular over the years, and there are over 300,000 of these procedures performed every year in the United States. Surgery can be done for many reasons. It can be done to enlarge both breasts, to match an absent breast to one that is present or asymmetric, or for reconstruction. Many women have breasts that don't develop during puberty, a congenital condition called congenital micromastia. Silicone implants were once considered banned in the United States for cosmetic surgery, but not for reconstructive surgery. They're one of the most studied devices, the silicone implants, and in fact, in 2008, they were re-released for cosmetic use. So silicone implants are placed in the majority of our breast augmentation patients at this time, with many patients still having the availability for saline implants if they wish to have them. Liposuction is another common procedure that is performed across specialties. Liposuction can either be tumescent liposuction, ultrasonic liposuction, or laser liposuction. The different types of liposuction actually are used to treat different amounts of volume. They also help to treat different skin conditions and help with varying degrees of skin contraction after such things as massive weight loss procedures or pregnancy and delivery. Eyelid surgery is a reshaping of the lids, and it can be done for multiple reasons. It can be done to improve vision, or it can be done simply to improve overall appearance of a patient. The lower eyelids many times have chronic puffiness due to allergies or lymphatic flow, and these can also be addressed where those lower eyelid bags can be removed and the lower eyelids can be repositioned to make them look more youthful as well as to be more functional. We have many other cosmetic surgeries that we discuss, many of which are performed by both the facial plastics procedures and professionals as well as plastic surgeons. As Dr. Haas and Dr. Howard both alluded to, there are top minimally invasive procedures. Typically, Botox and fillers are some of the biggest minimally invasive procedures that are performed across specialties. It's very important that you go to a center that has board certified and qualified physicians, as well as potentially nurse or advanced practitioners for injections. It's important because facial anatomy is very important knowledge to have in an effort to make sure that you avoid poor results or skin necrosis or injections into areas which can cause blindness or long-term detriment. Chemical peels and lasers are also one of the most common minimally invasive procedures. These are done across offices and in our cosmetic center by multiple physicians, and these are great for collagen production as well as tightening of the skin for a less invasive procedure with less extreme results than a cosmetic facelift. When we talk about those statistics are obtained by the American Society of Plastic Surgeons. The American Society of Plastic Surgeons is one of the largest organizations of board-certified plastic surgeons in the world. There's over 8,000 members, and it's very important that this organization has significant criteria for their members. They adhere to an extremely high ethical standard, as well as making sure that patients have access to an excellent website with information about procedures and research, as well as board certified professionals. If anyone is interested to view this website, it's plasticsurgery.org, and it has a plethora of information that can help you decide which procedures are best suited for you and help you decide which procedures are not suited for you. When you think about having plastic surgery, some of the questions to ask yourself are truly, are you healthy enough to have plastic surgery? Before you have plastic surgery, one of the things that you need to understand is your own medical history. Your plastic surgeon won't be able to give you an accurate estimate of what your results will be or how you'll handle plastic surgery if you don't give them an accurate history of your health problems. Some certain issues actually can prevent you from having plastic surgery, but it's much more important that you are alive and have an excellent result than to try to have plastic surgery and be unable to enjoy that enhancement. The next thing to ask is, what is the exact name of the procedure and what does this procedure entail? When someone says mastopexy and the patient comes in and says, I want my breasts lifted, it's important to understand that those are the same procedure. And that's one area where the American Society of Plastic Surgery website can really give information so that people can understand what their procedure is. You also want to know, is the procedure that's being described to me the actual procedure that I desire? So it's important to understand the name of the procedure that your physician is talking about and making sure that that coincides with the procedure that you wish to undergo. What are the risks that are associated with your procedure? Things typically go well. As we talked about with knowing that you are healthy enough to have plastic surgery, most patients that undergo plastic surgery are relatively healthy. But you need to understand that there are patients that can have complications. And it is important to understand what the risks of those procedures can be. Infection is just one of the complications that can occur. Also, as Dr. Howard showed in her pictures, and I'll show again later in this presentation, you will have scars. Scars are permanent, and any incision that a patient has will end up with a scar. And it's important to understand that the scars will be there as a trade-off for the procedure that you undergo, and those will stay. And that is one thing to ask yourself, am I willing to undergo a procedure and exchange my current appearance for appearance with a scar? The next question to ask is, what are you actually hoping to gain from your surgery? Obviously, you're hoping to gain an improvement in your overall contour, but it may boost your self-esteem. But if you expect more than a boost in your self-esteem and an improved contour, you may not understand the limitations of the procedure that you're asking to undergo. Because when we ask ourselves what kind of results we can expect, we can only control what happens in the operating room from a surgical perspective. Not every result is going to be absolutely perfect, and it's not going to be guaranteeing what the patient has in their own mind as their outcome. If someone is expecting that a result from cosmetic surgery will improve a relationship, social life, or socioeconomic status, it's likely not going to occur. It also does not cure depression or eating disorders. And those are some things that patients will believe that some of these procedures can help them with, but it doesn't guarantee that it can help them. It does, however, most likely improve their own self-esteem. Are there alternatives to undergoing plastic surgery? When we discuss the different non-invasive plastic surgery procedures or cosmetic procedures, there are some alternatives to plastic surgical procedures. Some people just need simply to change their diet or to exercise or to have some non-invasive procedures. So there are alternatives that actually have an invasive procedure. Will you be able to hide your scars? This is important to speak with your surgeon about, because if you have scars, you want to know whether or not you'll be able to hide them during the activities that are important to you. There is no scarless surgery. All surgeries have scars, and knowing where those scars will result and knowing whether or not those will be hidden during the activities that you enjoy is a huge understanding to being satisfied with that procedure. Are you willing to undergo more than one procedure? There's a likelihood that many patients will require a revisional surgery. It's not uncommon with plastic surgery. It may not be a major revisional surgery, but there may be some small revisions. So it's important to understand whether or not you're willing to undergo a secondary procedure, either under local or general anesthesia. This can add to the cost of your procedure, and that's an important thing to consider as you undertake this journey. Are you able to take off the appropriate amount of time to recover from a procedure? It does truly take time to recover from procedures, and depending on which procedure a patient is planning to undergo, it can change the amount of time that a patient needs to take off of their work or their regular activities. And it can also affect their activities of daily living and the activities that they enjoy. So it's very important to understand how this procedure will affect your ability to actually participate in those activities. So as you can see, when we look at these patients, it's pretty identifiable to the human eye and to our own conscious and unconscious thought process, which patients look older and which patients look younger, or which of the population or friends or family appear to be older and appear to be younger. And you can see the different wrinkles that come across the forehead, the emptying of the fatty tissue around the eyelids and in the cheeks, and some of the drooping that results from a loss of volume in the face. So when we look at patients, we do evaluate all of these things. And these are areas that Dr. Haas and Dr. Howard have mentioned as they talked about their injectable fillers. So there have been programs in the past where you can actually see patients or people, or even yourself, as an older adult. So there are people who will actually put their picture into a screen, and you can graphically illustrate to those patients at how things will actually kind of move as they age. And it's typical to see these areas of volume loss, where you can see at the temples, people lose volume. They lose volume in the upper cheeks, which adds to the hollowing of the lower eyelids, and actually adds to a more aged appearance. These are areas where patients typically wish to have addressed, and they wish to have surgical procedures or non-invasive procedures that help to mitigate those changes. The jowls are a common area. As we get older, we lose volume in the face, and that volume is no longer supporting the skin. And that's one of the reasons why people have jowling and increase in facial lines. So what does a facelift do? As Dr. Howard alluded to, a facelift actually can elevate the skin and the underlying tissues of the face. It redrapes and tightens the facial and the neck skin. It typically will involve some tightening of the cheek and the muscles that are underlying the cheek. It's typically done under general anesthesia. It can be done sometimes with heavy sedation and some local anesthetic in the right setting. There are risks that people need to understand with facelift surgery that can involve vascular structures, arteries, and veins. It can involve nerves, and it can actually involve skin loss and changes in overall facial expression. When we look at the evolution of facelift scars, it's important to go to board certified and qualified individuals. As you saw the incision that was healing nicely on Dr. Howard's presentation, it did not look like the top scar in this photographs. It looked more similar to the lower scars in these photographs. Those are the types of scars that we wish to have for our patients, not the scars that need to be covered with tattooing or some other form of camouflage. So these are typical areas where scars are placed. These are areas where we have typically got a little hint of a shadow or a shadow and a light, things that sort of distract the eye and allow us to place incisions in a very ideal and specific spot. As you see this patient, her scars are nicely healed. They're not very visible, and yet she has a nice lift to her face. Similarly with this patient, you can see a little bit of scarring within the temple hairline near the portion of the ear that's just in front, but truly those scars are nicely hidden and a good result. Similarly with this patient, many times if patients do not have scars placed in nice areas and areas that are aesthetically well hidden, they won't be able to wear short hair or to wear their hair in a ponytail. It can be important for patients who have longer hair to be able to put their hair up, and it's important for people who are used to having a short hairdo to continue to be able to do so and not be forced to grow their hair to hide their scars. Brow lifts are another type of facial procedure that helps to lift the brows, smooth out forehead wrinkles, as well as it will give some improvement to the upper lids because those facial units are very much connected. Brow lifts can be done in multiple ways. Some brow lifts can be done by making incisions in the hair, such as this patient, where it's well hidden within the hairline itself. It can also be done at the front of the hairline in someone who has a taller forehead. This is called a pretrichal, or in front of the hair brow lift. And this is a nice way to not change where the hairline sits, but actually to give a great overall improvement to the brows as well as to the upper eyelids. And you can see the change in the upper eyelid simply from a brow lift in this patient. In this patient, she had an endoscopic brow lift that involved sutures and different fixation devices that are within her hairline. Blepharoplasty is also called an eyelid lift. They can be done for multiple reasons. As I said earlier, they can be simply aesthetic because someone doesn't like the crepiness or the excess skin of their upper eyelids. But for many reasons, as Dr. Howard alluded, we do this for reconstruction and for improvement of medical conditions. So many of our patients actually come in with significant excess eyelid skin because they can't actually see out on the outside of their eyelids, or sometimes even on the upper portion of their field of vision. And that can be extremely dangerous when someone's driving. If they're driving down the freeway with blinders on, then I think that that's a great indication to have a blepharoplasty. Blepharoplasty removes on the upper eyelid typically a significant amount of skin. It can remove fat, and it can actually reposition the upper eyelid so that it can be much more functional. The lower eyelid typically removes the lower eyelid bags and a small portion of skin and repositioning of the lower eyelid position itself. So here's a patient who underwent upper lid blepharoplasty or eyelid lift, and you can see that there is a marked improvement in the amount of skin excess. Similarly, this patient underwent upper and lower eyelid surgery, and this patient has a significant improvement in the amount of skin that's there, and you can imagine to yourself that this patient probably has a better or improved field of vision than previously. Similarly with this patient, she had a significant amount of lower eyelid fat as well as upper eyelid skin, which was removed for improved overall appearance. We also perform cosmetic breast surgery, such as augmentation, reductions, and mastopexies. This is an example of a breast reduction to make breasts smaller, breast augmentation to make breasts larger, a combination of a lift and an augmentation. Body contouring procedures that we will also perform include abdominoplasty, thigh lift, brachioplasty, and liposuction. There's multiple different types of abdominoplasty which are located on your on the internet, on the website that I mentioned earlier. It tightens up the skin as well as the underlying musculature. So a few examples of abdominoplasty procedures here. Liposuction uses a small cannula to decrease the amount of fatty tissue that are in areas to improve overall contouring. And brachioplasty is an arm lift which removes tissue and volume from the upper arm. This produces one of the most unattractive scars because of the thickness of the skin being significantly less than other areas. Thigh lift is a great way to decrease the excess skin on the thighs. And we do also provide buttock lifts and buttock augmentation. They reshape the body, and most of these can be done as an outpatient procedure. We offer a full range of cosmetic surgery by well-trained physicians. Our services are in line with those other services provided by Mayo Clinic, and it would be an excellent place to get information as well as undergo procedures. Thank you. Dr. Hinni?
Thank you, Dr. Rebecca. And thank all of our speakers. We are here with a little bit over 15 minutes to go, and so I'd like to open this up to questions from from the audience. And as they're coming in, I was just noticing, and this, if the three of you would take your mics off, we'll have a little round table here. Aren't more men getting cosmetic surgery now? I didn't see a single man in any presentation.
They are getting more and more plastic surgery now. And in fact, even the genitourinary physicians in urology and gynecology are performing genital procedures for men in urology as well as women in gynecology. And men are also getting facelifts, neck lifts, brow lifts, and many, many non-invasive procedures. I think that that's the largest increase in the male population is for the non-invasive procedures such as injectables and laser skin tightening. Dr. Haas?
Yes, so I see a lot of men, all different ages, getting injectable procedures as well as laser procedures. So sometimes I have patients who the husband gets the procedures, but the wife decides not to. And so I think this goes for everybody, that if something makes you feel better, getting rid of the blood vessels on your face or your brown spots or adding a little volume or doing a little bit of surgery, I think that's really the most important, is, you know, helping patients feel better about themselves, men or women.
Well, Dr. Howard, you do an awful lot of rhinoplasties, I know. How many what percent are on men?
Right now, actually, our percentage on men for rhinoplasties truly is 50-50 when we look back at what we were currently doing. And part of that is that rhinoplasties aren't always completely cosmetic. They often do have a functional component to them. And so this is something where not only do you make someone feel better, but you actually improve physical health. And it's one of those really wonderful procedures that we all do inside this specialty that changes people's lives sometimes, and the benefit is seen across all genders.
Now, all three of you mentioned injections, particularly Botox. It's astonishing the number of procedures done nationally. So maybe for Dr. Haas, isn't it true that if you get Botox, don't you just have to keep getting it?
That's a good question. You know, I get asked that a lot. And, you know, the good thing with Botox or other neuromodulators, there's 4 brands out now, is that the procedure is very quick. It has about no downtime, and the results kick in about 2 weeks and last about 3 or 4 months. So if you've never had anything before, this is kind of a good place to start, because if you hate it, you don't like the results, it goes away in 3 or 4 months. But most patients actually do like it and like to keep doing it. And so, you know, the question is, what happens when it wears off? So your muscles kind of just go back to what they were before, and they might actually be a little bit weaker, because what Botox is doing is paralyzing those muscles. And so they kind of become weaker, just like if you didn't go to the gym for a few months and your muscles are weaker, Botox kind of does that same thing. So in the long term, even getting Botox once can be good for your overall aging.
Thank you. So what is, you know, if I'm thinking about getting some cosmetic surgery, given my apparent youth, should I wait, or what's the best time? Is there a right time to do this, or how do you decide that? I'm sure that a lot of our audience is, you know, is struggling with, should I do this now? Should I do this later? What's your take on that, Dr. Rebecca?
I think that there's a trend for different types of procedures at different ages. And so many of our younger patients will typically even potentially start in their 20s or 30s with minimally invasive procedures and such as injectables and lasers. And that's a great way to help position themselves to avoid different procedures in the future. I don't think that there's necessarily a right age, because as Dr. Howard spoke to earlier, people truly feel a certain age within themselves. So there are patients who are what we would consider quite a bit older, but feel quite young, that wish to have plastic surgery. And so if they're cleared by their medical physician, then there's not technically a right age for patients to get plastic surgery. The results may be slightly different or less dramatic in a patient who is a little bit older. But I think that, you know, truly there are a lot of procedures that we can do to make people feel good about themselves at any age.
Well, let's take another question from the Facebook audience. So maybe I'll direct this toward Dr. Howard. You were talking about rhinoplasties, and I think there's some confusion. The question is any of this covered by insurance? And I know that rhinoplasty is cosmetic, but it can also be functional. So where does insurance play any part in this?
It absolutely can. This is something that rhinoplasty, when we commonly think about it, a pure reshaping of the nose, is very commonly a cosmetic procedure and for aesthetic purposes only. But there's nothing about that surgery itself or the way insurance views the term septorhinoplasty, which is the full term. There's nothing about that that the word itself defines it as being either cosmetic or reconstructive. It's the patient's story and the symptoms that they're dealing with that determine that. So an individual that just simply wants a minor aesthetic modification, that may be truly completely cosmetic, especially in patients that have a history of trauma or functional nasal breathing. A septorhinoplasty is actually commonly covered by insurance, and it's something we do a very large amount here at the center. We do a lot of not only what's considered primary rhinoplasties, but also complex revision cases. And so we do things called rib rhinoplasties, where we actually use ribs to rebuild noses, either because of bad trauma, bad original development, or even potentially prior surgery that didn't go or turn out quite as hoped for.
Dr. Rebecca, of the common procedures you perform, is insurance helpful? And then I'll ask Dr. Haas the same. Are there mechanisms to utilize the insurance company for parts of what you do?
Some procedures, such as upper lid blepharoplasty or functional blepharoplasty or eyelid procedures, can many times be covered by insurance if it's shown that they have visual field obstruction or they're losing their peripheral vision. Occasionally, breast procedures will be covered by insurance, but many of the fully cosmetic procedures are not covered by insurance, and neither are the complications that can potentially occur from those. Those typically are covered as an out-of-pocket pay.
Dr. Haas?
When it comes to non-invasive procedures, most are considered cosmetic and not covered by insurance. Probably the one area where we are now able to get insurance coverage is when we're treating burn victims or burn scars with lasers. So we now have codes that we can use to get those covered. But the majority of other things are essentially just cosmetic.
Another question from the Facebook audience, and I'll throw this up for grabs here. Do you do Botox for TMJ? Do any of you do that?
Mm-hmm. Yes.
Yeah.
Let's
so
all of us do.
yeah, I think we all do. So for patients who grind their teeth and have enlarged masseter muscles, so the muscles here, if you just kind of bite down and feel how large yours is, if you are grinding your teeth, you can use neuromodulators for that. And it can be pretty effective and can last even up to a year in my experience.
Yep. Agreed.
Excellent. So it's no secret that my goal as medical director is to foment disruptive change in this space. And given that it's multidisciplinary, given that we have the opportunity for translational research to change how we do this and to do it better in the future, particularly with regenerative medicine technologies, I'll again ask each of you about next steps. I mean, you're all experts at what you do, you and a cast of many others behind you. What sort of cosmetic treatments do you want to see in the future developed and come out of this center?
So for me, looking at regenerative medicine's application to aesthetic surgery, I would love to see some of the developments and things that we use, especially for reconstruction, even further applied in this setting. Sometimes it goes the other way, where we use aesthetic techniques to make our reconstructions better, but for regenerative medicine, things like PRP to restore function, the use of fat grafting to restore volume, and more specifically now with special attention for recruitment of stem cells and resurfacing, is something that we do, but I'd love to see that expanded and with better science behind it, knowing that what we are doing is providing the best possible results with each of those techniques. And
I
for
think
that, we have to do studies.
And it's important for everyone to understand that we do those studies currently across multiple disciplines. The plastic surgery division has been involved with the otorhinolaryngology division for tracheal and laryngeal transplants. And we've also been involved with the Department of Gynecology to help develop stem cells from fat harvest in an effort to help with vaginal prolapse and urinary incontinence. So we are currently actively participating in multiple studies across the enterprise that are involving regenerative medicine from fatty stem cells. And I think that the sky's the limit as to what we can come up with in the future across these multiple disciplines.
Do you think it's possible to use stem cell therapy in your cosmetic practice in the near term? Dr.
We
Rebecca?
already do. We already use fat grafting, and although we don't typically call it stem cells, because the injection of stem cells is by definition an FDA monitored event that requires IRB research. We have for decades been using fat grafting for the treatment of burns, for augmentation of the face, assistance with breast reconstruction, in many areas for coverage of exposed hardware. There's so many areas that we can use this for a better aesthetic result as well as a better functional result.
So I would remind the audience that we are anticipating having FDA approval and IRB approved clinical trials so that adipose-derived stem cell therapy can be brought into the facial rejuvenation practice, for examples, and other areas of cosmesis. Dr. Haas, I interrupted you. I'm sorry.
Oh no, I was just going to say that I agree with the group on that, I'm really excited for the regenerative medicine component, and currently using PRP for hair loss and or androgenetic alopecia, and also using it post laser or microneedling procedures to help with healing, and we get really great results. So I'm excited to see how that expands.
So another question that has just come through here is would ever a lower face procedure, such as improving jowls, be covered by insurance? That might be a tough one, Dr. Howard.
Unfortunately, it isn't. The facelifts and facial rejuvenation are almost never covered when it's the lower facial component.
So Dr. Howard, what
Dr.
about...
Rebecca might have a comment. She looked like she...
I was just going to say that they're typically also not covered if someone has a medically indicated tumor resection or cancer removal on one side of the face, which ends up in that side of the face looking somewhat tighter and more rejuvenated. Insurance typically does not cover a symmetry procedure for that treatment either.
So a Facebook question, I'll direct this back at you, Dr. Rebecca. So if one is born with uneven breasts, so it's a young gal, and this is affecting her body image, any way that insurance would cover some surgical intervention in this?
So there are multiple reasons for asymmetric or uneven breasts, and depending on the underlying cause, and what the actual source of the asymmetry is. There are some conditions that are covered for symmetry. The majority of them are not, although it does affect body image. But there are some where there's absence of different muscular and skeletal structures that can be sometimes covered by insurance.
Thank you for that. So we have just a few seconds left here. We are getting some more questions through, but we will answer your questions, those that are sent. I promise we'll collate them and get them to the best expert. But I wanted to just end by asking the three of you, why you do this? What is it about, cosmetic surgery that you find rewarding, that you would want to train and specialize in this?
Yeah, I think that as we look at a holistic view of a person, whether it's what they eat, how they exercise, or any other manifestation that causes them to feel good about themselves, plastic surgery allows people to really feel as good on the outside and on the inside, and to look like they feel. So I think that allowing people to really be happy is one of the best reasons to perform cosmetic surgery.
Dr. Haas?
I would agree with that. It's so rewarding to have my patients come back after having a few of these small procedures done, and saying that they feel more confident at work, or they're more comfortable in their relationship, and seeing that they're happy, and seeing what a change that can make in their daily life is really rewarding, and that's my favorite part.
Dr. Howard?
I completely second that. This is something that the sensation of not being enough or not being perfect is universal to the human experience. None of us feel that way every day. And if there is a part of you that makes you feel that way, though, every day, where you feel less every day, having the ability to help someone fix that and feel better every day is an amazing gift to get to, one, have to give and to receive when they trust you to do that. And it's something, again, that we've all experienced. I've had acne scarring that really bothered me and made me feel less every day, and working with Dr. Haas, and she does my Botox and my laser, and I feel better, and I can share that with other people. It's wonderful.
Well, if you are joining us late, we have recorded this. The purpose was to introduce you to the first of its kind Multidisciplinary Cosmetic Surgery Center. There will be a grand opening here perhaps mid-October, and we're very excited about that. The differentiators for us are that we have experts in a variety of disciplines, all prepared to work as a team to support your needs. As well, we will provide first-rate educational experiences for the next generation of physician and surgeon trained in this center. And as well, we will provide translational research and run clinical trials to improve the status quo in the cosmetic space. So with that, we will wrap it up. I want to thank Drs. Rebecca and Haas and Howard for their time and their salient comments and their erudite presentations. Thank you, everybody.
Thank you,
Signing
Dr.
off.
Thank you.
Thank you, everyone.